Dr. Lieb. How are you?
Good. How are you?
Good. Thanks for joining me to talk about preconception, one
Of
of our
course.
very, very favorite things in our practice to talk about and treat. And you're a guru for this. So I'm going to be chatting with you and asking some questions. First off, okay, so a patient comes in for preconception. What's the best kind of time frame to have them work on this for, typically?
Yeah. I mean, really, in the most ideal situation, we'd be seeing people about 1 year ahead of time before they were planning on starting to try. But for a lot of people, that's not totally realistic. So we might be looking at like 2 to 3 months. That would be like a good time frame for us to really, get some things checked on and start optimizing them ahead of time.
Yeah, exactly. Because it's a lot of work. We'll talk about it. It's a lot of work. So that's great. And in terms of, we get this question a lot. Like people come to us, they say, I met my gynecologist. I want to start having, trying to conceive. All they say is take a prenatal, right?
Mm-hmm.
Is there but there's more we can do, right? I mean, how do we?
Yeah. So we want to kind of get ahead of the ball and, prevent the need for higher interventions in the future. So we could look at doing some hormone testing to begin with, and that could be either just through, blood testing that we can do easily, or if we wanted to go a little bit more in depth, we could always think about doing like Dutch testing, which would give us a little bit more information to go off of.
Right, because a lot of our patients, you don't need to have hormone problems to get a look at what's going on with your hormones, right? So a lot of patients come to us, they say, I really wanted to look at my hormone levels. My doctor doesn't want to do it. I'm having trouble getting it, but we look at that, right? Because it's relevant information for us.
Yep, definitely. And especially, if you're coming off the pill, we want to see what your hormones are doing now, as your body makes that adjustment.
Yeah, coming off the pill is a big thing, right? So in terms of timing of getting off the pill and doing testing, what typically we recommend how long to give it before you do any testing?
I would say at least 2 to 3 cycles after coming off the pill, just to really see what that timing looks like without the pill regulating it.
Yeah. And I'll put a little side note here that it's, coming off the pill is much, much easier than people think typically. So, get support from a naturopath. It's very, very doable. So, okay. So that's the hormone piece. Talk to me about, I know you like to talk a lot about charting and fertility signs with patients. Are you talking about them with patients at the outset about that?
Yeah, definitely. So we would kind of go over some things that would be easy to look at just kind of day to day, as far as like temperature and signs of ovulation and things like that can clue us into what's going on even outside of, the blood work that we're seeing. It's just like giving us day-to-day information, which is helpful.
Yeah, charting. And we talk to people a lot about kind of how to do that and the best way to do that. So, okay. And so speaking of blood work, other things we can look at on there, one of the big things, thyroid, right? I mean, that's something we definitely like to optimize before women are trying to get.
Yeah, exactly. Because the range that we're seeing for what's considered like normal from like your primary care doctor's opinion is really different than what we'd like it to be, even from our perspective day to day, but also trying to conceive, we want it to be much like in a much tighter range.
Much tighter range, yeah. And that tighter range is going to have a better outcome in terms of, much lower rates of miscarriage and so forth. So it's an important thing to pay attention to. So, okay, so moving from there, this is one of my personal favorites is looking at what's called the metabolomics test. So why do we look? This is a urinalysis. It gives us a ton of information, but why do we love to do that typically?
Yeah, so that's looking at nutritional status primarily. So looking at all different vitamins and micronutrients and how much of them your body needs for optimal support. So we can take a lot from this test as far as what is the optimal prenatal for you based on all of this information and get those levels up to a really good spot, beforehand. And that could also be looking at it through dietary changes that we could be making. But it also clues us into some other things like oxidative stress, which is really important to reduce that to support egg quality, mitochondrial function, and some other things too, like gut support, and kind of clue us into if we need any additional gut support as well.
Yeah, so many of our patients obviously have gut issues. And so this is sort of a good overview of what's going on there in the microbiome. So it gives us a ton of information, because one of the big things, people think about when they're trying to get pregnant is inflammation, right? It's this big, broad category, inflammation. Do I have inflammation? Am I detoxing well? And the metabolomics also really answers that question for us. So it's super invaluable. And it's okay. So speaking of inflammation, stress. This is one of the big things, especially when women are thinking about trying to conceive, right? You can get a bit stressed out about all the moving parts. So we really work on stress reduction and, mindfulness stuff. We can test for that too, right? Like typically, what do you do for that?
Yeah, so if we do Dutch testing, we'll see it on there. Cortisol is included in that, but we can also think about doing an adrenal stress test. So basically just spitting into tubes to look at cortisol throughout the day.
Yeah, super helpful. So we can see where in the day stress support is needed. And sometimes I find patients are like, I'm not stressed. And then we see their cortisol is through the roof just because their nervous systems have gotten so kind of used to being in a high kind of sympathetic overload, this fight or flight. And so that's something we really want to work on getting people out of right from the get-go. And we have a lot of techniques for that. Yeah.
Definitely.
So, okay, stress, partner prep. We love partner prep. So, what do we typically recommend husbands or partners come on in?
Yeah, definitely, to kind of just like get that additional support in as needed. And especially, if you're already making these great lifestyle changes, hopefully your partner can be making them as well. And both of you will just see an improvement.
Yeah. Sometimes we can do metabolomics or, nutrient evals for a partner, so we can talk about diet and definitely I always say better with a buddy to be doing this stuff. So, so that's great. So really the key is optimization, right? I mean, that's really the name of the game.
Yeah, exactly. Getting everything where it needs to be ahead of time just makes it easier in the long run, and an easier pregnancy, hopefully.
Easier pregnancy, better outcomes, and a little bit more control. So very cool. Well, thanks for chatting with me. Super helpful. Thanks, Dr. Lieb.
Of course. Thank you.